Hey folks, this is Doc Rich Bevan Thomas on Prostate Cancer Live, chatting with you about a very interesting publication in the Journal of Urology, one of my favorite journals, as you would imagine. And the topic of this article is the incidence of prostate cancer in hypogonadal men receiving testosterone replacement therapy. Observations from 5-year median follow-up of 3 registries. All right, what does this mean? So we're talking about men who actually have low T, which is sort of the buzzword, and in the urology and the medical community, we call it hypogonadal. It means that the gonads basically are just not functioning the way they need to, but it's testosterone replacement therapy. And what is the risk of these men? They don't have prostate cancer going in, but what is the risk of these men developing prostate cancer? And the median follow-up on this is actually 5 years. Very, very important study. Now, this was done over in Europe, and there was a bunch of, this was by Heider et al. There were several actually from Germany, the United Arab Emirates. So there was a lot of, this was a multi-institutional paper that actually looked at a number of these studies. So what did they find? Well, the first thing, I'm going to be the spoiler right here, is that they did not find an increase of risk of developing prostate cancer for men on testosterone replacement therapy. Let me say that again, because there is a lot of myths and a lot of folklore going out there that says if you go on testosterone replacement therapy, you are going to increase your risk of prostate cancer. First of all, I know of no data that says that if we put a man on testosterone replacement therapy, it's going to increase his risk. This actually found that you actually would potentially decrease the risk. This is about 1,000 men. We're going to talk about that in a second. But what we do know, at least in this paper, now I can't say it's the word of God, but I can tell you that it's a very good paper, and it's looking at these men over a period of years. Again, the median follow-up was about 5 years. But there was not an increased risk of these men actually being diagnosed with prostate cancer with a median follow-up of 5 years. And what does it actually say? Well, what they did was they took these men who actually they were hypogonadal, meaning that they actually truly had symptoms consistent with hypogonadism, which is a low libido, erectile dysfunction, fatigue, all those things that actually go along with testosterone replacement therapy. They weren't basically guys that just were 60-plus-year-old men that just felt like they wanted to start, competing in the gym and doing a new bench press competition. These men legitimately had a problem, and they legitimately had symptoms consistent with hypogonadism. So they started them on testosterone replacement therapy, and they followed their PSAs actually very, very closely, right? So without me actually going into the whole design of the study, I'm going to kind of cut to the chase and talk to you about what the findings of this were, because I think these are particularly important. So the incidence of this, again, with 1,000 men, they were prospectively followed. They've been following these actually men for quite some time. For a median follow-up, the incidence of these men with developing prostate cancer was 1%. Okay, so what does that mean? Someone would say, well, okay, you start on testosterone therapy and 1% of those guys had prostate cancer. So look, that testosterone caused that prostate cancer in 1%. Now, it's not the way it works. So we actually have several other studies. If you look at at several of the screening studies, as well as some of the other studies that were done previously, that actually looked at the risk of actually developing prostate cancer, if you even don't have prostate cancer, and it's upwards of it's somewhere in the ballpark of around 7 to 9%. Okay, over that, give or take that same time period. So can I tell you that you're actually inhibiting your risk of prostate cancer? I can't tell you that. But what I will tell you is that this paper, which is very well designed, is that we are not seeing an increased risk of men on testosterone therapy increasing the risk of actually developing a focus of cancer. It is, however, important that if a man decides to go on testosterone replacement therapy, that we follow them very closely. And we have a number of men, certainly in my clinic and my partners' clinics, where if we put them on testosterone replacement therapy, if we do start seeing that PSA rise at a higher rate than we'd like to see, we treat them exactly like men that actually aren't on testosterone replacement therapy. And we talk to them about the potential need for a biopsy or try to figure out whether there could be a focus of cancer. But we look at that and we look at every man individually, whether they're on testosterone or not. The takeaway from this is that we have a paper, and I would say a very well-designed paper, that looks at men with a median years of about 5 years follow-up on this, that shows that there is no increased risk of developing prostate cancer if they are on testosterone replacement therapy. It's very important. I think we're going to start seeing more and more of these studies come about as time goes on. And I think that, we need to really start looking at data in terms of who is at risk for developing prostate cancer. And we also need to be, of course, very careful about who we need to actually choose and who we should put on testosterone replacement therapy in general. Whole nother discussion on that, but this is one more paper. So guys on testosterone, you can at least tell your doctors that we do have several studies, and this is one of them, that shows that there's not an increased risk of developing prostate cancer. Other risks involved, but this actually shows what we need to show from a prostate cancer perspective. This is Doc Rich Bevan Thomas signing out, Prostate Cancer Live.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.